I'm a retired dentist, and in this video I thought I would share with you some tips and tricks I've learnt along the way with regard to oral hygiene, specifically brushing and flossing. But at the end of the video I'll also talk a little bit about tongue cleaning and how that can help improve bad breath. Now, right at the beginning I want to say there's no single correct way of cleaning your teeth, and everyone's mouth is different. So if you've had some advice about cleaning from a dental professional, follow that advice, because it's probably specifically designed for your mouth and your situation. And while we're on that subject, cleaning starts with a visit to your dental professionals, because you can't really do a good job with your oral hygiene if you've got a lot of tartar or deposits on your teeth, and if you've got broken fillings or cavities, or if you've got gum disease. All those things need to be corrected first, and then your oral hygiene is basically designed to maintain a healthy situation, but you need to get your mouth healthy first before you start. Right, that's enough talk. Let's get on with it. My first topic is brushing. Now, to do a good job with brushing, you're going to need a good toothbrush. And the way I choose a toothbrush is I like one that's got a soft bristle. So if you run your thumb across it like that, it feels nice and soft and smooth. And when you finish running your thumb across it, the bristles spring back immediately. The other thing I like is quite a small head to the toothbrush, so that I can get in all the nooks and crannies at the back of the mouth where there's not a lot of room. With regard to toothpaste, I don't really care what kind of toothpaste I use, as long as it's non-abrasive and it's got fluoride in it and it tastes nice. The brand is not important to me. Right, let me show you how I go about brushing. So I'll just open the jaws a little way. Now, I always use the same sequence when I'm brushing. So I'll usually start top right, work across the outside of the top teeth, then come back across the inside of the top teeth, and then do the biting surfaces. And the same on the bottom. I'll start on the bottom right, go right around, come back on the inside, do the biting surfaces. And the reason I do it in the same sequence each time is because if I lose concentration and I'm thinking about my next video or something, then I know where I've got up to and what I've cleaned and what I haven't cleaned. So, now the first thing you have to understand is that there are hundreds of little nooks and crannies and crevices all over the mouth, and it's a good idea to know where those are so that you know where to target your cleaning, because plaque loves those little places, and that's where it's going to start. So there's a little crevice between the gum and the tooth along there, so that's one of the things you have to clean. The other thing is between the teeth a little way. You can't get all the way between the teeth, that's why flossing is important, but at least you can go a little way between the teeth. And then on the biting surfaces, there's usually a few fissures and very tight crevices that bacteria love to get into, and we often see decay starting in those fissures or in the inaccessible places. This is an area where I used to find a lot of decay, is the bottom back teeth right near the gum line on the outside and the inside, and also on the top teeth, the last 2 or 3 molars right up against the gum line is a favorite place for decay to start. So those areas you've got to clean really well, and I'll even try and get behind these last teeth. So now let's have a look at the actual technique. I like to come in at 45 degrees so that the bristles can penetrate that little crevice I was talking about between the gum and the teeth. And also, this is why I like a soft brush, because now I just put a little bit of pressure and you can see those bristles are shaping to the shape of my mouth. Some of them are going into that little crevice between the gum and the teeth, some of them are going between the teeth, and the cleaning action that I use is just little circles like that, and I'll clean about 2 teeth at a time. So I'll do about half a dozen circles, and then at the end of it I'll sweep away from the gum, and as I do that, the bristles go between the teeth a little bit further. And then I just move along, a couple of teeth, same story, a few circles like that, making sure that the bristles are reaching the gum, and you can feel it on the gum. As you do this, you can feel the bristles gently massaging your gums. And everything that you do must be gentle, because you can actually do some damage if you get a bit aggressive, or if you're using a very hard toothbrush or something like that. So always remember, gentle is the way to go. So then we get all the way around the outside on the bottom, and then we've got to come back. I normally come around and then come back on the inside like that. Same story, little circles, go right down to the gum and sweep up. And go all the way around there. I find the front teeth, it's easier to just do that. It's quite difficult to get the little circle motion going. And then the top is exactly the same. You just get your bristles 45 degrees, gentle pressure so that they go in those little crevices between gum and tooth and between the teeth, and you come all the way around like that. Now, the reason that I do little circles is because if you brush like this and you're just going in one direction, most of us over time will get a little bit of gum recession. The gums will recede down the root a little way, and the root's much softer than the crown of the tooth. And as you do this over time, you'll wear a little groove on the gum line like that, and we often see that, and those often have to be filled. So very important to use multi-direction, because if you're just going in one direction, the bristles go and cause a little gutter in your teeth. Then once you've done the outside and the inside, the front is also, I also prefer to just go back and forward like that when I'm going behind those front teeth. And then the biting surfaces. Again, on the biting surfaces, use little circles, because the fissures on the biting surface of the teeth are very complicated and they come in at all different angles. So you need your bristles to take all different angles to get in there and clean them. So circles is the best way to go. Right, talking about space in the back of the mouth and the difficult areas to brush. One of the most difficult areas to brush is the top teeth right at the back on the outside where the cheek lies. And the reason for that is that your jawbone, your lower jaw, has a joint there, and it lies a little bit over those teeth. And when you open wide, what happens is that the jawbone comes forward and covers those teeth that you're trying to clean. So a trick that I use is to almost close my mouth so the jawbone moves back, and then that just gives me that little bit of extra space to get in there and clean the outside of those top back molars. So that's a tip you can take home. Right, that's basically your brushing done. And I suppose I brush for about 2 to 3 minutes, so it's not a lot of time. Now finally, it's very important that your toothbrush is in good condition. As soon as the bristles start curling, they don't work anymore. They don't get into those little crevices that we're trying to clean, because they're bending away from your working surface. And I'll show you this in a diagram, might help you to understand. But as soon as your bristles start getting a bit bent, chuck away your toothbrush, buy a new one. It's not a lot of money. I reckon I get about 6 weeks out of a toothbrush, and then the bristles start curling and the cleaning's not that good. So now, just to show you how a new toothbrush is better than an old one, here's the old one with the bent bristles, and you can see the debris in that little crevice between the tooth and the gum. It can't penetrate because the ends of the bristles are bent over. And if you look on the other side, this is a new toothbrush with straight bristles, and they can get right into those little crevices and clean them out. So that's the value of the new brush. Now finally, I'd like to just say something about electric toothbrushes. I, for the last 5 years, have been using the electric toothbrush, and I find it does a much better job than a manual brush in my hands anyway. What I like about them is they've got a nice small head, so I can get in the little nooks and crannies. But when I'm in those tight areas, I don't have to do anything. With a manual brush, you've got to try and still be able to move. And if your cheek's there and your muscles and your jawbone's all there, it's very hard to get in the back there. Whereas these, you just get there and then you don't have to do anything. Because the head of this toothbrush, this is an Oral-B 3D, the head of this toothbrush oscillates left and right. And at the same time, it goes forward and back. So that's why it's called a 3D. And it does that at very high frequency. So it knocks the plaque off very, very easily, and I find it does a really good job. But you still have to get it everywhere. You have to use the angles that I've been telling you as well, because you want to clean all the same areas, but you just have to do far less work. So I'll just show you. And let me give you a tip about this. The first time I used an electric brush, I put the toothpaste on the end, pressed the button, and the toothpaste went flying everywhere, and I got most of it in my left eye. So that's a little tip that you can take home from if you've never used an electric toothbrush. Anyway, you put a bit of toothpaste on the end there, get it in your mouth first, get it on the first surface you want to clean, and then you switch it on. And there you can see it's doing exactly what that other brush did. And I also sweep up quite a lot with the electric toothbrush, because that cleans the gaps as much as you can with a brush. You still have to use floss after that. So I'm using the electric toothbrush all the time. Now occasionally when we're traveling, I might go back to a manual, but mostly it's an electric toothbrush. Right, moving along now, we're going to talk about flossing. Now, there's a lot of different kinds of flosses, and it depends on the situation in your mouth which one will suit you. I've got quite tight gaps between my teeth, so I like this one. It's called Oral-B Glide. It suits my situation, but it's best to chat with your dental professionals to find out which one is best for you. Right, first job is you pull out some floss. I usually take about just 35 centimeters. Okay, now the important thing is you need to wrap it around your middle fingers like that, and you leave a little bit free to do the flossing. So I keep my thumbs and my forefingers free so that they can guide the floss to where I want it to go. Now the flossing action is not just in and out. Very often you can just damage your gum by doing that, and you'll get a bit of cleaning done, but you don't get a really efficient job. So what I do is I get the floss in the gap, then I wrap it around the surface that I'm cleaning. And remember, there's 2 teeth for each gap, so I've got to clean each tooth separately. And then the cleaning action is scraping. I scrape up and down, and you go down below the gum level, just a little way. Don't hurt yourself, just gently below the gum level, because you need to clean that crevice between the gum and the tooth where the 2 teeth are in contact as well. So just scrape 3 or 4 times and then come out again. Then in the same gap you go in, but now you wrap it around the other tooth and you scrape up and down like that as well. And every gap in the mouth needs to be flossed that way. And the back teeth are particularly difficult, but if you take your 2 fingers like that and you come behind the last tooth, wrap it round, scrape up, wrap it round, scrape up, and that's the way to get around there. Now it's important to floss because your brush can't clean between the teeth, and as I said earlier, the plaque bacteria love to hide in these little nooks and crannies, and I often used to find decay between teeth, and that's why your dental professionals will do x-rays regularly so that they can pick up any problems between the teeth before they get too bad. Now I brush twice a day, that seems to be sufficient for me. But if you're snacking between meals or eating a lot of sweet things, plaque can grow faster. So you may have to do it more frequently if you're a snacker. And chat to your dental professionals about that. They'll help you there. But my advice is try not to snack between meals, and particularly sweet drinks or sweet snacks. Those are going to grow your plaque faster. It's like fertilizer for plaque. If you have anything sweet in your mouth, it's not important once you've swallowed it, but while it's in your mouth, the plaque bacteria love it and they multiply at a very high rate. And of course, plaque is what causes tooth decay, and secondly, it also causes gum disease. So if you want your mouth to be healthy, you've got to keep the plaque away, and that means perhaps adjusting your diet and also adjusting your cleaning frequency. Now the final topic I'm going to talk about is bad breath and tongue cleaning. Now your tongue is rough on the surface and it's got lots of nooks and crannies. Your taste buds actually live in deep crevices in the tongue, and bacteria love collecting there. And over time, the back of your tongue can get a bit of a coating. And if your tongue gets a coating on it, it cuts out the oxygen, and the bacteria that are in the nooks and crannies will then change from a type that uses oxygen for energy to a type of bacteria that doesn't need oxygen. They call the anaerobes. And the anaerobic bacteria produce substances that we call volatile sulfur compounds. And unfortunately, these substances stink. And that's often where bad breath comes from. It's not the only source of bad breath, but it's quite a common source of bad breath. I do tongue scraping about twice a week, and I find that helps to keep my breath fresh. And not only that, getting rid of that coating on my tongue improves my taste. I can even taste water straight after I've cleaned my tongue, and I've often wondered why people like wine tasters or food tasters don't do a bit of tongue cleaning in between. Now, there's a couple of ways of cleaning your tongue. One is some of these brushes that you get have got a rough surface on the back of the head of the brush, and that supposedly is for cleaning your tongue with the scraping action. But I find they are not very effective, and I'll demonstrate in a minute why I prefer to use what we call a tongue scraper. But again, the important thing here is to be gentle, and I do 2 or 3 scrapes with the tongue scraper with gentle downward pressure, and then I stop. If I still see some coating on the back of the tongue, I know it's not going to come off. We just leave it there. It could be part of your mucosa, and if you keep scraping, your tongue's going to get very raw and you're going to injure yourself. So it's a gentle 2 or 3 scrapes, and leave it at that. Now I'm going to demonstrate tongue cleaning, but I'm not going to gross you out by showing you how it's done on my tongue. And I'm going to do it on a little bit of sponge, and in that sponge I'm going to put a bit of white salad dressing, so don't get grossed out about it, it's nothing unpleasant. And then just so that you can see how the tongue scraper works, as opposed to those rough patches on the back of toothbrushes that you get sometimes. Right, now to demonstrate tongue cleaning, I've got this little sponge which I have soaked in some creamy salad dressing just to make it look authentic. Now the first thing I'm going to do is one of these toothbrushes with the rough edge at the back there, which is supposed to clean your tongue, and I'll just show you what that can do first. So if you press down and you scrape, it does quite a good job. It's removing a bit of debris. But the reason why I don't use one of these is because it doesn't express the fluid that's deep in the crevices of your tongue. And that's where some of these anaerobic bacteria are, and a lot of the volatile sulfur compounds will be in the crevices of your tongue. So by just cleaning this way, you'll get the debris off the tongue, but you won't be flushing those deep crevices. And I'll just show you, this is a tongue cleaner. I actually designed this one and made the mold myself when I was still practicing. But this is the one that I favor because I'll show you how it works. If you take the tongue cleaner and you press down gently, and as you press down, it squeezes the fluid out of the crevices, and then as you move forward, you'll see the white salad dressing collecting, and that is cleaning those deep fissures and pulling all that muck ahead of it, almost like a little bulldozer, and that cleans. Look what's come off there, which you wouldn't get with this type of tongue cleaner. So that's why I prefer a tongue scraper, but as I said to you, it's got to be a very gentle motion, and you just do it 2 or 3 times. Don't keep going because you could injure yourself. Now, another thing I wanted to mention about bad breath is to remember that it's not just the mouth that can cause bad breath. Problems with your nasal passages, your sinuses, your respiratory system, and even your general health can affect your breath. For instance, if you've got any infection of the lungs or sinuses or nasal passage or anything, tonsils, certain diseases like liver disease, kidney disease, diabetes, all of these things can affect your breath, and also what you eat. Some foods and drink can be excreted through your lungs, like garlic, for instance, and alcohol. So those smells can come out in your breath. So all of those things can be affected, and it's not your mouth that's causing it. The other thing that's quite important is the volatile sulfur compounds are water soluble. So while your mouth is moist, they're usually dissolved in your saliva and they're not coming out in your breath. But as soon as your mouth dries out, then they start coming out in your breath. And that's probably why we get morning mouth or morning breath, is because your mouth's dry. And so anything that causes you to breathe through your mouth and dries out your saliva, or if you've got low saliva flow, these kind of things can affect your breath as well. And you can do a little experiment. If you lick the back of your hand try and get right back on your tongue, the back of your tongue, lick the back of your hand, and then smell it straight away, and then leave it a few minutes or a few seconds, and then just smell it as it's drying out. And as it dries out, you'll be able to smell those volatile sulfur compounds. Another thing I wanted to just mention, just to help give you a bit of motivation, the cost of oral hygiene is nothing. It's about 5 minutes of your time twice a day, and a toothbrush costs about $5, and the floss about $5, so you'll have to change them about 5 times a year. So you're probably coming in, your total dollar cost for oral hygiene is $50 or $60 a year. If you can save yourself one filling, which is well over $100, you'll get some change. And it's almost like your dentist is paying you to clean your teeth because you're saving so much to the dentist. And a filling is quite cheap, but when you start getting on to things like root canal or crowns or bridges or implants, then you're talking thousands of dollars. So it's a very, very good investment to spend $50 or $60 a year and a little bit of time cleaning your teeth. Now, just a final word or two. It's a good idea to have regular checkups with your dental professionals. And while you're there, I would suggest you ask them to just check how your cleaning's going, and if there are any little areas that you're not cleaning well. And then they can help you to get into those areas and clean the best you can. The reason for that is that if you leave plaque anywhere, over a period of time, it's going to harden to form tartar, which is something like the scale that you get inside of a kettle. And then once that forms, you can't get it off at home. You have to have it professionally cleaned. So good idea to keep an eye on how you're performing. Thank you for watching. And if you enjoyed this video, please like and share it, and subscribe to this channel if you haven't already done so. And if you click the bell next to the subscribe button, you'll get notification when our next video comes out. And if you have any questions or comments, we'd love to hear from you. Just scroll right down to the bottom. You'll find the comments section there. Stay safe and thank you for watching.